Hey guys, I am so excited today to introduce you to our newest member of the Sanare Functional Medicine team, Dr. Ana Rodriguez. Welcome, Ana.
Thank you.
Of course. So guys, I am literally feeling so blessed that Dr. Ana has joined us. And I want to take a minute to tell you a little bit about her, and then we're going to let her tell you about herself. My goal with this conversation is that you will feel as grateful and excited and as hopeful as I feel that she's now part of your care team. But I also want you to know how amazing Dr. Ana is. And I want you to feel comfortable scheduling with her because she's someone that I really look up to and that I frequently ask about care, right? We're collaborating all the time. She teaches me things all the time. So I want to take a minute to brag about Dr. Ana. So Dr. Ana is a naturopathic doctor and an acupuncturist. And so she practices naturopathic and functional medicine, as well as traditional Chinese medicine, which means she has a really wide toolkit to help you. Additionally, she did 2 degrees in the time it took me to do one, so you know that she's smart. And she has some really cool experience in working with particular populations that I think you guys will be really grateful to learn about. So, Dr. Ana, can you tell us who you are and what brought you to this medicine?
My name is Ana Rodriguez. I am originally from Baltimore, Maryland, and then we kind of traveled around a little bit and then met Dr. Kate in med school at Bastyr in Seattle, Washington. So we've both kind of been coast to coast, which is kind of awesome. Um, so how did I find naturopathic medicine? So originally I was pre-med in undergrad, and I kind of always knew I wanted to be a doctor of some sort. There was a year there where I was like, you know what, I'm going to be a veterinarian.
Yeah.
So I kind of did all the things for pre-vet. But then I took a trip to the Dominican Republic and was there for a whole summer. And I lived at an orphanage and did a lot of public health things with the community that I was working with. And that's when it kind of clicked with me that, you know what, I want to work with people. I want to do some public health initiatives, things like that. So I went back to Davidson, which is where I went to undergrad. And, kind of decided I'm going to go all in with the pre-med thing. Was also a theater major there. So, switched it up a bit. So I did pre-med, and at Davidson, it's very, people kind of do the very traditional track, which is great. So I didn't really know what else was out there outside of conventional medicine. So I jumped through all the hoops, took the MCAT, all that stuff, and was kind of ready to apply for med school. But after Davidson, I took 2 years off just to kind of figure things out and realize, I want something a little different. I want more tools in my toolbox. I want to be able to spend more time with patients and think outside of the box a little bit more. So I reached out to a family friend, Dr. Erin Kinney, who is a naturopathic doctor in Maryland, and asked her everything about naturopathic medicine and just kind of fell in love with it, fell in love with what she was telling me and how she was practicing. And I love, the different perspective that we can have when it comes to people's health. So at that point, I was like, yep, I'm all in. This is what I'm doing. So I ended up visiting Bastyr in Seattle, and it's a beautiful campus. Definitely highly recommend checking it out if you're ever on the West Coast. And I was like, this is where I want to learn how to become a doctor, and this is the type of medicine that I want to do. So I applied and started early in the summer. And while I was at Bastyr, I also learned that they offered a dual track. So I could also get my master's in traditional Chinese medicine. And that was also something that felt right for me because I really do also like kind of the physical medicine aspects of what we do as naturopathic doctors. And I think Chinese medicine is so amazing. There's thousands of years of wisdom. And so to be able to combine the two types of medicine was just really appealing to me. So yeah, that's how I became a naturopathic doctor and an acupuncturist.
It's a beautiful story. And I think one of the things I love about you is that you sort of seamlessly blend a lot of things into art, right? Which you talk about a lot. So can you tell us a little bit about each of these medicines for some people who might not know? Maybe you're sitting at home, guys, and you're going like, well, this sounds great. And she seems awesome, but like, what really is naturopathic medicine and what is traditional Chinese medicine? Can you tell us?
Yeah. So the way that I kind of look at naturopathic medicine is that we treat the whole person. So we look for the root cause of illness, and we meet the patient where they're at in terms of how a therapy kind of meets a pathology or an illness or an issue that a patient is dealing with. But we try to start kind of on the low end of things, or the therapeutic order is what we call it, and work our way up, again, to meet the patient where they're at. As naturopathic doctors, we have really big toolboxes. So, in school, we learn about herbs, we learn about homeopathy, we learn physical medicine, which includes adjustments, manipulation. And we also learn about pharmaceuticals and things like that. So, how do pharmaceuticals interact with herbs? How do herbs interact with each other? How do pharmaceuticals interact with each other? So, our toolbox is just so wide. So, we really have so many different things that we can do. And it's really cool because I feel like when you look at naturopathic doctors and naturopathic medicine, if you kind of brought 10 doctors in the same room together, we would all practice a little differently or very differently. But it's awesome because we can learn from each other, and we all do beautiful work. So it's very fun in that way. But it allows us to be creative and really think outside of the box. And so yeah, so that is kind of how I view naturopathic medicine. But yeah, it's a more holistic approach, I guess, to medicine than conventional medicine is. Um, and then for acupuncture, so traditional Chinese medicine. So first of all, I highly recommend the book, The Web That Has No Weaver. It's a beautiful book that really, in such a nice way, just explains what Chinese medicine is and how we practice as practitioners. It's very different than Western medicine, very different than naturopathic medicine, in that we diagnose differently, we treat differently. So we treat with acupuncture, with needles, we treat with herbs, but different. We use different herbs than in naturopathic medicine, and we just use them differently. But Chinese medicine, so the idea is that we have channels of energy that kind of run down our body, in our body, and they're all associated with a different organ system. And so when I am seeing a patient and, deciding to do acupuncture, what I do is I feel your pulse, I look at your tongue, I listen to your story, and I decide, okay, this channel, this organ system needs a little support, needs a little energy, or it's overactive. And I choose points on the body to support the organ systems that I think need a little help. And it's super gentle, and it works with your own body's energy, which is why I love acupuncture. It does involve needles, and so some people, don't like that aspect of it, obviously, but there are other things, that we can do, like acupressure. We also do cupping and gua sha and things like that. But yeah, acupuncture is, again, there's thousands of years of wisdom behind Chinese medicine. So the cool thing about it is that you're kind of a lifelong learner in Chinese medicine, because there's just so much information. It's just so vast. And even this explanation of what Chinese medicine is, I feel like just barely grazes the surface. But if you're interested, highly recommend The Web That Has No Weaver, because it just does a really good job of explaining it. But the one thing that I will say, and that the that has no weaver kind of talks about, is that you could have, 5 patients come in who all have migraines, let's say. Um, and each patient might get a different needle prescription because they may all have a different diagnosis pattern. And so that's what is also really cool about it, is that the treatment is so unique to you, and it's so unique to each time you come into the office because we're always changing as people. So yeah.
That's beautiful. Beautiful, beautiful. So I think what I want to reflect and kind of summarize for you guys at home who might be like, wow, that sounds amazing. Is that Dr. Anna is equipped to listen to you, to truly listen to you, right? With a medical detective ear, but also a really heart-centered approach to hear your story, every part of it, and then to use one of thousands of possibilities to help you heal. And this is a beautiful adjunctive approach to conventional medicine. If you're someone who has depression, anxiety, migraines, and you're trying the pills, they're helping a little bit, or you've gone to a chiropractor, it helped a little bit. I think one of the most amazing benefits of sitting in front of someone with Dr. Anna's vast amount of training and expertise is that she can really draw from a ton of information and experience in helping you and help you wade through what can really feel like a lot of options. If you're someone who's used to researching on the internet, you may have spent several $100s on supplements or treatments already, right? And because she's so well trained and so experienced, she can really help you find the fit for you, for your unique biochemistry, which is great. So how do you want people to feel when they think about seeing you?
So I want people to feel hopeful. And I want them to feel excited about the future of their health. I think, I like to take the approach that I'm on the journey with you. I'm not telling you what to do. I'm here to support you. We're in this together. And so that may mean that sometimes I don't have all the answers, and that's okay too. But what I will do is, figure out what you need. I will Google with you. I will make the right referrals for you. For example, if there's something that Dr. Kate is more equipped to handle, I might say, hey, you know what? I think Dr. Kate would actually be a really good person to work with for this specific thing. Or if we need to, refer to a provider outside of Sanare Today or whatever it may be. But yeah, I feel like, I just want you to feel taken care of, and like there's somebody that's going to do all of the legwork for you to get to the place that you truly want to be with your health. Because that's important.
Yeah, like a new team member, a new family member almost is
Yes.
what you're saying. And
Yeah.
while Dr. Anna is being very humble, guys, and I think that's something that we connect on, is this deep place of humility where it's like, you know what? The more you know, the more you realize, my God, there's millions of scientific papers out there and more being like published every day. Why would we not want to collaborate?
Mhm.
Right. But at the same time, you are truly brilliant. And I think I'm already excited, guys, because like anybody who's postpartum, anybody who wants to do women's health, I have already been referring to Dr. Anna. So you have some pretty cool areas of expertise. Can you talk to us a little bit about them?
Yeah. So first of all, I really, really enjoy linking all of the systems of the body together.
Yeah.
And so I feel like that is something that I'm very good at. So if you're coming in with something that's maybe hormonal, or you're having issues with, let's say with your periods, or yeah, let's say with your periods. I'm not just gonna, look at your reproductive system and say, okay, let's just do some hormone testing, or let's just, throw some things at you to see how we can balance out your hormones. I'm gonna look at your, reproductive hormones. I'm gonna look at your adrenal hormones. I'm going to also look at your gut health. And kind of just, try to connect all of the dots and try to get to the root cause of what's going on. Um, that is what is fun for me. And I love, and I kind of love helping people make those realizations like, oh yeah, you know what? Like I didn't notice that I was bloated all the time, or that I, didn't have a bowel movement every day. Um, and oh wait, it's all connected. Like that's so interesting. So yeah, so that I really, really like connecting the dots in that way. So yeah, I also did a 2-year residency recently, so I focused in a lot of, I did primary care and also women's health. So primary care things can range, obviously, like you see a primary care physician for everything, basically. But I saw a lot of endocrine disorders, metabolic disorders, um, reproductive issues. And so those were kind of like the top, and GI, so gastrointestinal. Those were kind of the top things that I saw. But again, all of those things are so intertwined and deeply connected. So like I could say that like I specialize in women's health, but at the same time we're working on, when you have a visit with me, we're working on all of those we're like working on your whole body, and kind of connecting all of those things. And then I recently had a baby in December.
Yay.
And so through that process, I've worked with pregnant women, I've worked with people in that postpartum phase prior to pregnancy for me. But after having a baby and going through it myself, I kind of realized the holes in the care that people receive. So I'm very passionate about helping people in that postpartum period. So whenever that is for you, it could be, day 3 postpartum, I am ready to to see Dr. Anna and kind of work on some things. Or it could even be 8 months postpartum, I need help, we need to figure things out. But what I realize is that we don't receive enough care in that period of time, and it's a really hard time. There's so many hormonal changes going on. You're trying to figure out how to take care of this baby that you just have this baby all of a sudden. And I think we focus so much on the birth part of the process that we kind of forget that, oh hey, now we have this whole other thing to think about. And there's so much newness to it and beauty, but also, it can be really tough and a really hard time. So I am really passionate about working with people in that postpartum period, kind of, educating about what your hormones are doing and why your body feels the way it does, and just helping you feel, balanced, and helping you to connect with that new version of you, as you journey into motherhood. And that even includes breastfeeding concerns and things like that as well.
So the beauty, guys, is that Dr. Anna is working virtually for us for the next few months and at night. So your partner gets home, takes the baby, and you hop on a Zoom consult with Dr. Anna. And I think that's one of the best things in postpartum is to have people come to you.
Yeah.
Yeah. And also this idea that like you can thrive postpartum.
Mm-hmm.
It does not have to be hard. You can plan
Yeah.
for it. You should be
Yep.
planning for it in your pregnancy for sure.
Yep.
Right. Even before you're thinking about getting pregnant, and particularly if you're someone who has mental health issues as part of your picture, you must plan for it. And so,
Mm-hmm.
right. So I want you like getting started early and often with Dr. Anna, get ahead of the postpartum changes. So you're ready. So it's easy. And so you are thriving.
Mm-hmm.
Often it's hard when we're caught off guard, when we don't have capacity, when we don't have support, when we aren't prepared, when we don't have the supplements we need, when we don't have the foods we need, right? We can help you prep for all of that so that you feel awesome. That's the goal, right?
Yes.
Yeah. So I love that. And just so you guys know, and Dr. Anna and I were exposed to some of this in school, but the postpartum period is also known as the 4th trimester,
Mm-hmm.
right? Which is like your baby is so completely dependent on you, it almost pregnancy like way where your body is still fully supporting them. And so of course you deserve support for that, but you deserve support from a provider who actually gets it
Mhm.
and who really truly knows the herbs that will help, that are okay to use when you're postpartum or breastfeeding. These are questions that come up for a lot of folks all of a sudden, is like, oh my God, well, I want to take this stuff. Can I breastfeed with it? Or, is it okay? Beautiful. So I love that you want to support people in that transition period and help them thrive. You also work with everyone,
Mhm.
including adolescents.
Mhm.
Yeah. Tell us a little bit about the other folks that you love to work with.
Yeah, so I love working with teenagers. And I think that it's such a formative time, I feel like, for people. And it's just, I think for them, it's nice to have a provider that listens to them and is like, hey, you know what? Like, okay, thank you for acknowledging that high school is just ridiculous, and that my hormones are just everywhere and things are, feeling really intense right now. There is this intensity about being a teenager, that, you know, is great. And, teens just have so much energy and things like that. But I really like to help them feel more grounded and more, I guess, feel more grounded in who they are and who they're becoming and where they want to go. Not meaning like, what do you want to do when you grow up, but like, what kind of person do you want to be? How do you want to present yourself to the world? You're becoming an adult. What does that look like for you? How are you communicating with your loved ones? What are your relationships like? Things like that. I feel like I wish when I was a teenager, I had a provider that was like, like, here's some things that can help you with this certain thing, or, this other thing over here. So yeah, so I just love supporting teens in all aspects of their healthcare, just helping them navigate that wild time that is high school.
And they're going to come in, guys. And if you're a parent listening to this, like, your teen's going to come in because they want clear skin,
Mm-hmm.
help with their mood,
Yep.
bigger muscles, if depending on what is important for them, to reduce their anxiety, to stop
Mm-hmm.
their panic attacks. Like, they have their own agenda, right? And we can fix all of that stuff.
Yep.
Full stop. You want to stop their panic attacks? We got you. You want to fix their skin? Got you. Fix their gut? Done. Easy.
Exactly.
That's honestly the easy stuff for us, which I want to take a minute and pause, because I think we don't even talk that much about that, because it's like,
Yeah.
well, I can fix your skin, right?
Yeah. Yeah.
But
Yeah.
like, you also want someone who just genuinely likes teenagers to be talking to your teen,
Yeah.
because teens can feel it when
Mm-hmm.
they're with a provider who doesn't. And I think what Dr. Anna and I are both really passionate about is just being like a adult who's in your teen's corner, but also
Mm-hmm.
someone that like they can look up to too. And that's important for you as
Yeah.
a parent, to have somebody that you're like, I want this other adult in my kid's life to be guiding them and helping them and affirming them, right? And showing them what's possible.
Mm-hmm.
So we are happy to be that for you. And we're also happy to be a sounding board for you. If your teen doesn't want to come in, you can talk to us about your teen, which I have a lot of parents in my practice who do that. Like, they have appointments with me about their teenager, right? And they're like,
Yes.
you don't need your teenager's consent to start cooking more foods with fiber in it, which will kill their skin, right?
Right.
Like, you can just put it on the table and they'll eat it. And you can also get support through parenting. It's
Mm-hmm.
not easy. And so that's a lot of what we do here too. So I love that. And you are into sports medicine, and your husband is also a physician who specializes in pain management.
Mm-hmm. Yes.
So I love that you kind of like, you have a vast array of tools, but you also have like a person at home who is an MD and like doing pain management that you can consult with. So you truly
Yes.
like
Yes.
integrative care in every sense of the word. But yeah, tell me a little bit about what you do with sports med and phys med and stuff like that.
Yeah. So I, like I said earlier when I was talking about acupuncture, I really like the physical medicine aspect of what we do as naturopathic doctors. For me, that looks more like craniosacral and visceral manipulation. which are two modalities that I use in person. Obviously, I can't do them virtually, which is sad, but one
Yeah.
day.
So Dr. Anna, just so you
Yes.
guys, is going to be in person with us in a couple months,
Yeah.
on the East Coast. For now, she's virtual. But it's good to establish care with her now, because then when she is nearby, you can see her in person and get craniosacral therapy. And when we're using the word manipulation, what that means, it's a medical term for basically movement.
Yes.
Just so visceral manipulation means like moving organs,
Mhm.
adjusting body parts, like a little bit like chiropractic. Um, but back to what you were saying, Dr. Anna, I didn't mean to.
Yes. Yeah, no, thank you for clarifying that. Yeah, so moving the organs, moving the bones in the body, and craniosacral is, visceral is very gentle. Craniosacral is even more gentle, than visceral manipulation. But yeah, so as far as sports medicine goes, I was also an athlete in college. I ran track. And so I definitely understand all of the aches and pains and just, trying to learn how to feel your body in a healthy way, to be able to sustain. For me, it was, 3 seasons of running. It was all year. So, figuring out how to not get injured. And so I, love to use nutrition and herbs and supplements. And then also, physical medicine tips and tricks that you could even do at home that you don't need to be in the office for. So tips and tricks that, I've learned as an athlete, and also, that we got training on in med school. But yeah, so again, kind of, I think, especially as a female athlete, understanding how, I think understanding how your hormones are working is really important, especially when you're competing. Because, sometimes it's like if you're having really painful periods, it's going to be hard. If you have a track meet coming up or a lacrosse game coming up, I know that it causes a lot of anxiety and almost panic when you're like, how am I gonna play my sport? How am I gonna do what I need to do or what I love to do? So again, I kind of take a whole body approach, when I work with athletes, because there's, again, everything is connected, and there's always more that we can work on. There's lots of digging to do. But I think just optimizing your sports performance and
Mhm.
especially your recovery is really important to me. So I feel like that's kind of where I like to spend a lot of time. I know, especially when I was an athlete, like, kind of in it, I was like, "Ah, I don't want to rest. I don't want to recover." But it's so important. And so that's what I really love focusing on.
Just keeping you healthy for the long term, guys, because I think Dr.
Exactly.
Anna gets it, where like she does not want you to be sidelined by an injury. We want you out on the field. So
Exactly.
we're the experts in high performance treatment, right? How do we get you better fast? How do we keep you well longer?
Yeah.
And you can do all this virtually, literally at home on your bed, like in your PJs.
Yeah.
Do not do this. So I love that you're doing this. The last thing, Dr. Anna, I wanted you to talk a little bit about, because this is another thing that I really love about you. Both of us have a passion for democratizing access to good medicine. And I want you to talk a little bit about what that means for you.
Yeah. So I think it's so important that people have access to naturopathic medicine. So people in underserved communities, people who wouldn't necessarily be able to afford it. So for me, I think especially I'm Puerto Rican. So, my family's from Puerto Rico. And spending a lot of time there and kind of seeing how like my dad grew up and things like that, like they had very little access to healthcare. And I think that's kind of where like my inspiration, I guess, or where my inspiration comes from with that. But also, I feel like in our country, just in general, people don't have the healthcare that they need. And I think naturopathic medicine can help these communities so much. We do so many awesome things and so much good work. So So yeah, so I, eventually really want to be able to do some outreach, provide care in a way that's affordable for people, and yeah, and just get people what they need, especially Black and Brown communities. Those are communities that are really important to me, and um, part of who I am. So, that's really important.
Yeah, I love that. So one of the criticisms, guys, of functional medicine is that it's for walking wealthy white women,
Women, yeah.
right? And that can unfortunately be true, particularly in states on the East Coast and that aren't in northern states where politics has prevented naturopathic medicine from becoming licensed. And so as a result, we can't take insurance. Where Dr. Anna and I trained in Washington State, we could take Medicaid. So people of any income could see us and it was fully covered.
Mhm.
And that was really amazing. And we are trying to bring that same care to the East Coast and keep it affordable. One of the ways that we do that is through presentations and programs. And so we're going to have some programs coming from Dr. Anna where you can pay a low fee and learn a lot from her, maybe a couple hours of recorded content. Group programs, right? Where we're able to lower the rate because you're in a group program with maybe a couple other people. So we've got a lot of innovative strategies to bring you this care. And then this is why we do things like we post and we do blogs and we write so much at Sanare to democratize access to that medicine. You are born in a human body. You should know how to make it work. You should know
Mhm.
what foods to eat to nourish your body. It sounds simple, right? It's not. The science behind it is quite advanced, but we are going to work to make sure that long term, you're not spending tons of money on supplements and medications, that you feel so good that you don't need to come back to the doctor. What we always tell folks is like, yes, come in. Our goal is to heal you fast and quick and cheap, and then get you out and you just like forget you ever had to come to the doctor, and then like send us pictures of your trip from Italy, right? And like
Yep.
you thriving, and we'll put them
Yes.
on our wall. Like that's what we want for you. And we work really hard at Sanare, and you guys will see this if you read some of our case studies that we've published, where we tell you exactly how much a treatment costs to get someone cured. So like recently we helped someone cure their migraines for under $600, migraines that they'd had for 2 decades, multiple times a week. Another case study, we helped someone cure their insomnia that they'd had for 3 decades for under $1,200. Like we are very proud of this. We're very conscious of this. It's why both of us are committed to not making money from supplements. We do not make money from testing. That money stays in your pocketbook. We're recommending treatments that will actually get you better, not just treat your symptoms, so you don't need them for life, right? So we're doing everything we can to make this affordable for you guys. And that's why I trust Dr. Anna so deeply, because I know how much she cares about people. And that is the number one thing we look for in a clinician at Sanare Today. So Dr. Anna, I'm so thrilled to have you coming on board. You are working Monday through Thursday, 6 p.m. to 9 p.m. EST virtually, which is amazing. You guys can literally like throw your kids on the soccer field, have them go practice and set up your appointment in your car.
Yeah.
Phone appointments, not just Zoom, right? So whatever you
Mhm.
guys want, Dr. Anna is flexible and can work with you. And I really cannot wait for you to meet her. So thank you so much, Dr. Anna, for joining us
Thank you. I can't wait to meet all of you.
today. Be well, guys.